Good day, my name is Mikhail Bidemacale, and I'll be discussing about my case report in pharmacology, and mine's about a neuromuscular disease. Let's now go to my case study. An 84-year-old patient with dementia has been prescribed Risedronate daily. So what are the nursing actions you should anticipate with the patient, and what might be the concern that you would require discussion with the physician? Let us now go to our case facts. So what is dementia? Dementia is an overall term used to describe the loss of cognitive functioning. So it is caused by the damage or loss to the nerve connections in the brain. And the thing about dementia is, it is a progressive disease, so it means that it cannot be cured. But it can be slowed down by the use of medications and certain therapies. So examples of dementia are Alzheimer's and Parkinson's disease. Both are considered as dementias. So let's now go to our medication, which is Risedronate. So in our case study, Risedronate was given daily. But what is Risedronate? Risedronate is a kind of a bisphosphonate, and it works by preventing bone breakdown and increasing the bone density of a patient. So Risedronate is a treatment and prevention of postmenopausal osteoporosis, glucocorticoid-induced osteoporosis, and even Paget's disease of the bone. So now that we know that Risedronate is given to prevent bone breakdown and increase bone density, we will now know how to administer Risedronate. Risedronate is given orally either once a week or daily. The dosage depends upon the doctor's orders. So we must know how many or what is the dosage before giving it to the patient. Next is that upon giving Risedronate, we must make sure that the patient is in his or her upright position. So we must take note that the patient hasn't taken any meals. It should be given first thing in the morning without meals to increase the rate of absorption. Going back to our case, what are the nursing actions you should anticipate with the patient, and what might be the areas of concern that would require discussion with the prescribing physician? So first, what are the nursing actions you should anticipate with the patient? Our patient is an 84-year-old woman with dementia. So if our case facts are clear, she is already 84 years old, postmenopausal. Next is she has dementia, meaning she has increased risks of bone injury that may be due to dementia, which is common symptoms are confusion and hallucinations. So there might be an increased risk in falls that may require hip fractures or other bone injuries. So, of course, our drug that would be given or that was prescribed was Risedronate to increase her bone density and to prevent the breakdown of the bones, if ever that she may acquire such injuries. Upon giving her the medication, we should give it in an upright position. It should be given daily or once a week, without, of course, the food to increase its absorption rate. What if the patient lives alone in his or her house? So in the Philippine setting, of course, we have close family ties. We would teach the patient's relatives how to give the medication and what we should do upon giving it. His or her neighbors could be possible, and of course the public health nurse or the public health worker's duty to give them, and we should instruct them that this patient needs to take that medication. Next is, what might be the areas of concern that would require discussion with the prescribing physician? Why must we know the dosage given to us, or the dosage that was ordered to be given to the patient? So Risedronate has its adverse reactions to the patient. It can include nausea, diarrhea, increased or recurrent bone pain, headache, dyspepsia, acid regurgitation, and even dysphagia. So that is my case study. It's about Risedronate, a bisphosphonate given to prevent bone breakdown and increase the bone density of an 84-year-old patient with dementia. Thank you.